All right, so another interesting topic that I actually came across while I was doing a lot of research on just physical activity and the effects on low back pain, or the relation with low back pain. So I found a lot of information on endurance training and some of the effects on spinal degeneration, and actually hope to share just some of the positive information that comes from the research looking at different types of endurance training on actually preventing or at least delaying spinal degeneration. So first off, I think it's really important to talk about the anatomy of the spine, just to have a background and understand the kind of role of the different parts of the spine in contributing to low back pain. So the intervertebral disc, which is kind of the central topic of this discussion and kind of the focus of this discussion, is aptly named. It sits between the two vertebral bodies, so there's one that's superior and one that's inferior, and then the intervertebral disc lies in between them. And the intervertebral disc is then made up of the annulus fibrosus, which is going to be the center of the disc, the outer portion of the disc, and then the nucleus pulposus, which is going to be the center of the disc. And the outer portion, that annulus fibrosus, is kind of made up of this stiffer, what they call fibrocartilage, that is really able to withstand a lot of the compressive forces that occur when the spine is loaded. And then the inner portion of the disc, the nucleus pulposus, is more of a viscous material and acts as the shock absorber. So it absorbs the impact of the body's activities and the load placed on the spine each time the body moves, and keeps both the vertebra, those two vertebral bodies, separated. So it's kind of integral. The intervertebral disc, as you'll see, is actually integral to the progression of degeneration that occurs in the spine, and unfortunately a lot of the pain pathologies that occur resulting in low back pain. So one of the kind of interesting reasons that we focus on the intervertebral disc is because it is so integral to absorbing the impact of the body as we move. And every day we're putting stresses on that intervertebral disc, depending on what we're doing, that pressure may be different. So that intervertebral disc, again, it really absorbs that impact, that pressure that's placed on the spine, from gravity. It kind of, in any daily activity or athletic activity that you engage in, the disc itself, when it absorbs that load, it can absorb that load in a kind of congruent way, in a way that distributes the forces equally across the disc, or it may absorb that load in an uneven way. And the load and the pressure that's actually put on the disc is going to differ depending on what position you're in, and whether you're lying down, sitting down, whether you're leaning forward, whether you're carrying weight. And these are all things that kind of add up over time and are definitely important in considering the effect of physical activity on the spine. So we'll get into too much detail on that, just that the pressure on the disc can be based on position, and then also on the weight, abdominal pressure, and a few other things that are important in considering the kind of integrity of the intervertebral disc. Now, the role of the intervertebral disc is, as I mentioned before, is really important in absorbing the load that is placed on the spine. So it contributes to that weight-bearing ability of the spine. It's also really important in motion and flexibility of the spine. The fact that the vertebral bodies can move in a way that allows you to flex the spine or extend the spine or move laterally or rotate. So definitely integral to the health of the rest of the spine. And if you look at prior studies, they've actually shown that the degenerative process actually starts with the intervertebral disc, and not just with the disc itself, but actually with that nucleus pulposus, that inner portion of the disc. And then it extends outward to the annulus fibrosus, that outer portion of the disc, and then into the vertebral bodies. So the end plates of each of the vertebral bodies that contact that disc. And then it progresses, so it goes kind of from stages, as shown here. There's A, B, and C, and from each, A is going to be normal, and then or maybe just changes with the nucleus propulsus, but then it kind of degenerates over time. And as you see in the figure B, now you have degeneration of the end plates of the vertebral bodies, and then progresses to level C, which is going to cause narrowing as the disc itself becomes flatter. It doesn't really keep those vertebral bodies apart very well. Then everything gets compressed, and so you can get spinal stenosis, or you can get kind of arthritis in the joints and some of the what we call the facet joints of the spine, and that can actually impact some of those nerves that come out and cause pain. So as far as the intervertebral disc and the role that it plays in pain, again, I kind of mentioned that it really is very important in the generation of low back pain, and it can have an effect in multiple different ways. This is just showing different ways that the disc can be degenerate or change in a way that causes pain. So there's degeneration of the disc, as I mentioned before, which then causes this kind of compression of the spinal canal or the foraminal openings, which is where nerves come out, and if they get impinged or pinched, they can cause pain. Another reason that you can have pain, or the disc can be related to pain, is you can get bulging of that disc or herniations of the disc itself, and that usually happens when there's an unbalanced mechanical load on the spine or on the disc over time. It deforms the outer ring of the disc, and part of the inner ring actually protrudes outward, and if it contacts any nerves nearby, it can cause a lot of pain. So this can be from physical activity, it can be from trauma, it can be from chronic degeneration. So lots of different reasons it can happen, but unfortunately that is one very common reason that people develop pain, and it's directly related to that disc. And then one other way, kind of down the right corner here, that you can develop pain is it's called annular tear. It's actually, there's no herniation of the disc, there's just a tear in the disc. And the outer portion of the disc has a lot of innervation, has a lot of pain fibers. And so when that portion is torn, you can have a lot of pain in that area. And unfortunately, there's not a lot of treatment for that kind of trauma. Usually it will heal on its own. It just takes time. Some scar tissue forms in that area, but it is more prone to injury or trauma in the future. All right, so that was a lot of bad news, I know, but kind of coming up on things that we can do to keep our intervertebral discs healthy, and also things that we can do to treat pain related to the disc once it's occurred. So kind of more on the prevention side, like I said, there is actually data out there that shows that certain loading types may be beneficial to the intervertebral disc. And this is really, they've looked at dynamic axial loading at slow to moderate movement speeds. And this is kind of a magnitude that occurs in walking, jogging, running, and cycling. They've actually shown that long distance runners and joggers have better hydration and glycosaminoglycan levels, and this was based on imaging, than the non-athletic individuals. And there was actually evidence of intervertebral disc hypertrophy in long-distance runners. So they are actually larger, and then that means they keep the vertebral bodies more separated, so there's less narrowing in the spine, which is a good thing. The best evidence is going to be for positive adaptations related to slow to moderate speed running. And then there's also evidence from cycling studies that looked at long-distance cycling, and the cyclists had better disc quality with greater disc height, so that same intervertebral disc hypertrophy, and better disc hydration, as well as glycosaminoglycan content. And the other thing they noticed was that they had psoas muscle hypertrophy, so some of the muscles that support the spine, which is going to help take some of that load off of the spine, which has good positive long-term effects. So what does that mean? Incorporating some kind of slow to moderate speed running and or cycling into your physical activity can help with kind of long-term effects of or on the spinal kind of column, and prevent degeneration over time. Avoiding movements that cause extreme flexion and extension of the spine, especially under load, which especially if they cause asymmetrical compression of the disc. Those movements can lead to degeneration over time, and so if it's possible to limit these movements, what I'm thinking about is, rowing has that kind of extreme flexion of the spine. A lot of gymnastics has that extreme flexion and extension of the spine, diving as well. Those are all activities that are going to put you at a little bit higher risk of degeneration over time. So if you can avoid those movements, then it's going to be protective over time. And then, as I've said multiple times, really avoiding sedentary lifestyle and staying active, because physical activity has been shown to have positive adaptations, and reduced physical activity and disuse of being sedentary. The studies actually show that this is detrimental for the intervertebral disc. And as I said before, the intervertebral disc is integral to the overall health of the spine. So if we can protect that intervertebral disc, then we can protect that spine and prevent low back pain over time. So physical activity also seems to improve nutrient supply to the disc, really important. The disc is a very avascular structure. It's hard to get a lot of nutrients to that disc, and so anything that kind of increases the blood flow to the disc, increases nutrient supply to the disc, is going to be good for it and good for the spine health. And then other things to keep in mind to keep your back healthy is going to be good posture. Again, if you go back to that slide from before, looking at the effects of different positions on the spine, and the pressure on the disc. One of the best ways to reduce the load and the pressure on the disc is by really standing upright, having good posture, using a lumbar support while sitting, and then really maintaining a healthy body mass index and avoiding excess abdominal weight, which all puts more pressure on the disc. Now, if you already have a back problem, you already have pain in your back, low back pain, you're already struggling with it, that is a little bit different. One thing that I can say is that most low back pain does improve with time. The studies show that. Working with patients has also really confirmed that. So it does work. Time is helpful, but it can be very frustrating to have to kind of take it easy and allow yourself to heal. There's not a lot of evidence that procedures speed up the healing process. So there are certain procedures that I do as a pain physician that can help improve pain symptoms. It doesn't necessarily improve the healing process. It doesn't really speed it up, but it can reduce pain so that people can be more active, engage in physical therapy, engage in different kinds of physical activity as they're healing. So maybe procedures. The best evidence for treatment is going to be physical therapy and then lumbosacral stabilization exercises. Again, back to physical activity. Physical activity is good for the spine. And then there's more and more data coming out on regenerative medicine for interdiscal therapy. I'm not going to get into detail here, but just things to think about. This is going to be in the future, but there's a number of different types of regenerative therapies that are being evaluated right now, including plasma-rich protein and stem cell therapy, which can be derived from adipose tissue, bone marrow, or the umbilical cord, and then different growth factors and gene therapies that may promote repair of collagen and proteoglycan makeup of the disc, and may be beneficial in repair and then preventing further degeneration of the spine. And honestly, that's really all I have. I just wanted to share that. I think it's just really good data and really good literature, and hopefully will provide you with some ways to stay healthy and really avoid low back pain. All right. So thank you for listening. If you want to check out any of the resources I used, please feel free to go research this on your own. And certainly if you have any questions, either shoot me an email or look me up online. I look forward to hearing from you.